Thank you very much, and good morning to all. It's a pleasure again to be here and to talk about the importance of policies that are evidence-based and that we know have an impact. I am a results-driven person. I grew up in an environment where, like you, around me, people were committing suicide. I lost my friends. I had the opportunity to have a conversation with Minister Agate on this, to tell her about, my experience and why I came to public health. And this was one of the reasons why I decided to do public health, because I could realize that the environment where we were all living was leading to, my friends committing suicide and dying. So this is why I'm in WHO. I love what I do. And I make sure that I whatever I do is results-driven and has an impact, because this is what matters. Can we really have an impact in people's lives? And this is what drives me and drives my colleagues in WHO. So we work a lot on policy because, again, I did a lot of clinical work as well. So I worked with individuals. But then I also discovered that, I was limited in the reach of how I could impact in people's lives. And that through policy and through advising ministers and the government on the best policies to be implemented that were evidence-based, the impact could be larger. So it was not just about a handful of people. Any life is worthwhile. So even if it was only one, it would have been worthwhile, which was. But, there's much more that can be done. So I'm very grateful that you invited me yesterday, and I see Madame Mayor, the mayor, so that I was invited to the film opening yesterday, because that allowed me also to have a better insight into what drives all of you to this room today and has been driving the conversations, but also has been driving your lives. Because as someone that comes from the outside, what I saw was a lot of pain, a lot of grief, and a lot of also reflection. But I would like to shift a little bit that reflection from the individual level to the context where all of this harm is happening, and that has a role on it. So I'm going to talk a little bit about, how do we go about the context? How do we go about having an environment that helps people to thrive, to live better lives when we talk about alcohol and the risk that alcohol poses to suicide, for example. So I'll start my talk, and you have in your tables presentation in Danish, because this is going to be in Greenlandic, but you have it in Danish in your table if you want to follow, and I'll speak in English, unfortunately. So I'll give some background context, and I will talk about, what are public alcohol policies, the best buys, and then, some conclusions. Okay, so let's start a little bit, just talking about alcohol. what happens in Greenland, and how different or alike are the patterns that we see here. And what we see is that we have patterns that are very much aligned with the high levels of heavy episodic drinking that we see in other Nordic countries. And in particular, we see, and you've seen from Ashley's slides, that binge drinking poses a significant public health challenge for Greenland. Because, again, while the average of total alcohol per capita consumption here is still below, slightly below, the average in the European region, it's still quite high. So the people, on average, in Greenland drink quite a lot. But the big issue is about, and you remember those slides, that slide yesterday, is about the pattern of drinking. So we have very high prevalence of heavy episodic drinking, both in adults and in young people. And why this is important? Because, again, studies show that alcohol has a major impact in the brain and has a major impact in impairing not only decision-making, but also in suicidal ideation. So alcohol is a toxic substance that has an effect in neurotransmitters, and then it really reduces the amount of some of those substances, transmitters that we need in our brains to feel well, to feel happy, and it has an impact in the way that the brain works, especially with these very heavy episodic drinking patterns. So there's a big research that was done on that basically has shown that alcohol is a substantial risk factor for death by suicide, in particular in young people, increasing the risks of death, by something like 94%. Exactly because it has an impact in the brain and it has an impact in creating those changes that then leave room for suicidal ideation. Not only that, the fact that people grow in families where the problem is also present, where you grow as a child in a family where you have someone that committed suicide. This also has a big impact in terms of the way you grow up, and it's linked to what we call, again, trauma. And if it's not dealt with, it brings an additional factor, risk factor, to a very difficult situation where your brain is already also affected by, these moods that are depressive moods. So you have not only a risk factor that is affecting your present behavior, but you have other risk factors that come from the fact that you have not dealt with the consequences of growing in environments where there's childhood mistreatment, where there is trauma because you assisted to suicides, and all of it coming together, where alcohol is very much present, creates the perfect storm to the situation that you have. So both the individual risk and the context risk are extremely important to understand what is happening. And as we see by the numbers, heavy episodic drinking has a major impact in the situation that we are seeing. One of the common arguments, and Ashley was addressing some of the myths, but I would like to particularly focus on this myth. is the argument that, since it's not the majority of people that drinks or drinks to a certain level, that it's enough to have targeted measures for problem drinkers instead of having measures that restrict what we call, public's freedom to use alcohol. Well, this perspective is unfortunately not based on science. It looks nice. It resonates, very, nicely, but it does not reflect the evidence. We have decades of evidence that demonstrate that alcohol problems are a result of the fact that alcohol is available, and more you have alcohol available, the higher the problems will be. And you've seen it in Ashley's slide that, this is reflected in the total amount of alcohol that is available. So, again, the more you have availability of alcohol and the more alcohol is affordable, the more you will see the consequences at a societal level. And this is why it is so important to create environments that really promote healthy options. And the policies will benefit the entire population. And I go back to the fact, that I started talking about suicide and the context where you grow and the role of alcohol, because what we have also seen was very nicely portrayed is that alcohol is always there in this trauma and feeding, all these relationships. And then it's not dealt with. It becomes an individual thing, but it's not an individual thing. It is a societal problem. It's everywhere, and it can only be addressed if there is a systemic approach to the problem. So how do we do this systemic approach? The systemic approach is about policies, implementing policies that we know have an impact. And these policies are called the best buys. In WHO European region, 53 countries. So I coordinate this area across 53 countries. There were a lot of discussions on what is the best way? What are the key policies that we want to be focusing on? Because there's many options that would really drive action, drive impact in the region, to address the harms that we have and that we see. And the member states have agreed to these 6 areas of action, considering that it's not about implementing one of them, but that it's about having a comprehensive approach that brings, interventions at the 6 levels, meaning that it's not just about affordability or, raising prices. It's also about having, other measures, including community action and health services response. So one also important element is that these policies, these WHO Best Buy policies, have been studied. We have a lot of evidence, and we have been using this approach also in non-communicable diseases at large, because we know that these are the policies that work. And why is it that they're called best buys? Because they have a demonstrated and quantified effect. So we know that once you implement that, not only, they're cost effective, but they also have an impact, and they can be easily implemented. And we are going to look a little bit to those policies and how they resonate in the Greenlandic context. The first policy, and for which the evidence is so clear in terms of its impact in consumption and in reduction of the harms, is the raises of the prices. is about reducing the affordability. And this can be done through excise taxes and through pricing policies. However, these are well underutilized in most of the countries. And despite of the potential that they have, including in reducing heavy episodic drinking, which is a pattern in Greenland, we see that, and the potential that they have to generate positive revenues for the governments, we have clearly difficulties in implementing this policy. And you see that there are areas for potential improvement in Greenland, and some ideas here on what we have looked at, and that could be areas where more could be done. I understand that the price of alcohol is quite high already in Greenland, but these are some of the ideas and some potential areas where you would still have room for improvement. Just note what I said at the beginning is that one should not implement only one policy measure, because this will not be enough. It will not reason across the society, and it really requires that more measures are implemented. So these are some of the possible interventions that can be considered by countries. We have, the possibility to have, very specific measures such as implementing, specific alcohol taxes. And yesterday you heard some of the measures that Canada has implemented in some of the provinces as well, and all of them have an impact, once you implement them. The next one that I would like to talk about is about availability. And availability is an essential measure to prevent easy access to alcohol. It's very clear. Why availability is so important? Because we know also that it really impacts young people and very high-risk vulnerable groups. This is, again, an area where, for example, and looking at Greenland, there's potential for improvement. We have areas where, for example, the regulation of, licensing systems or outlets still can benefit from additional measures so that the availability is reduced. And this is an extremely important measure, including, reduction of availability on online sales, that what we see tends to be an increasing trend in all countries, and I assume that could be, at least in the cities, one of the mechanisms that is not regulated and is working as a means to deliver. This is extremely important also because we know that the harms happen at home. So online sales facilitate the delivery in secret, I would say, to the house where the harms are happening. And therefore, it is extremely important to be regulated because it can prevent a lot of the harm from happening, including provision of alcohol for people that have already identified high-risk drinking patterns and even dependence from alcoholic beverages. So these are some of the examples, again, that can be considered when we are regulating availability of alcoholic beverages. Licensing systems that cut across and regulate the production, the wholesales, the delivery, and the serving of alcoholic beverages. Very important is the density. I know that you have quite a lot of efforts in terms of the location, but density is also very important, as well as regulating the hours of sales and the legal minimum age. Marketing is the other third. It's the third WHO Best Buy. These are measures that have an important impact in terms of the protection of the children and adolescents, because we know from evidence that marketing has an influence on social norms and has a very strong influence on the starting age of drinking. We know that children that have been exposed to marketing tend to drink earlier in life than those who have not been exposed to marketing. And not only that, what we know is that it changes the pattern of drinking. So the exposure to marketing also changes the pattern of drinking, with heavy episodic drinking being one of those patterns that we see that has been changed because of exposure to marketing of alcohol. Importantly, things like sponsorship and contacts are very and promotion are very important activities that need to be regulated, because again they influence the availability and they create opportunities for normalizing the social norms. And this is why industry invests so much in marketing. We don't necessarily consider this as an area that influences us. We bring it back to the individual responsibility, but what we know is that it's really about shifting the social norms. I've worked in countries where not drinking was the social norm, and I have seen and reported on how marketing can shift the traditional norms very quickly in a population. And I can tell you that it's just frightening to see how you can, when we hear this expression, it's embedded in the culture, we cannot change, it's there. I mean, this is not true. You can change culture from one day to the other, and I can tell you that you can do it very quickly. You just need the means to do that. And of course, industry has, very, high means to do it, and that's why they invest a lot of their benefits in making sure that we have and we are all subject to these very nice messages, so that we can think that it's about individual responsibility, that this is only about certain people, that life is beautiful when you drink, that the best thing to have, normal conversations is under the influence. And we buy all of this. It gets into our routine. We don't even see it. But I would argue, and many times people come and say, I had a conversation with my husband yesterday, and alcohol, we drank, and it really facilitated this conversation. And I can only say how sad it is that we've lost the capacity to talk. And we can only do it under the influence of a drug, because alcohol is a drug that has an impact in our brain. That's why we can easily talk, right? So we need to understand that this, it comes in everyday activity, and then we don't even see it anymore. We just consider it as being normal. It becomes normalized. So we have to recapture the narrative. We have to capture back the things which are essential, the connections which are essential for well-being, for having a meaning in your life. And, this doesn't come by using something that changes your mood. This comes by, changing the way you perceive life and the critical things that you consider as being important in your lives and the quality of the relations that you establish in your lives. Then, okay, I'm talking too much, so I'll go fast. So these are some of the measures that can be considered. Now I go to my favorite slide. So I heard that you really want to see, does it work? Well, it does work. It works. We have examples. Lithuania being the best example that we have. But, I mean, one of the examples, I would say. We have studied this country. We have studied other countries. So it's not just Lithuania that can have, such a, clear evidence that when you implement policies that control alcohol availability, affordability, you have an impact in terms of the reduction of alcohol consumption. And once you have an impact in the reduction of alcohol consumption, you will see immediately a reduction in all-cause mortality. And this is the difference between alcohol and tobacco and many other substances, many other things, is that you see immediately the impact once you introduce these policies. It's not a long-term, result. No. You see it immediately. And you can see here, you see the lines in green and the lines in red. Red is when you liberate, those control policies. So alcohol becomes more available, it's more affordable, and you immediately see the impact. So you see the lines here, and you see that, it's really like a butterfly, right? You increase consumption because you have released those control measures, and immediately when you do that, you decrease life expectancy. You increase mortality immediately. So it's really, as you will see here, you see the green lights, and then you see, the other. So you will see that it has an impact. It has an immediate impact. And we've studied this not only in Lithuania, but in other countries. We've published about this. And, it's clear. It's clear that, and this is another example from Lithuania, on the impact on male mortality. Again, if you introduce measures, and this was about restriction of availability, because we looked at, how do each of these measures operate. And by limiting alcohol sales hours on Sundays, so you see here how much the country has reduced male mortality. So this is, very clear evidence, just by a very simple measure, which was, sales on sales hours on Sundays. So a huge impact in mortality. If we look at Greenland, you also have examples. The minister has been a pioneer and has implemented, one very important Best Buy. And you can see here that the reduction of alcohol available in 2018, when these measures, so the curtains on grocery stores have been implemented, and also the ban on alcohol advertising. So you had the decrease on the sales, right? And what happens when you have a decrease on the sales, so this was, 2017, right? Is that you immediately see, that reducing consumption is there. And as you will remember again by that figure, that image that Ashley has shown you, when you do that, you push the curve to your left, and this means that you'll have less harm, you'll have less mortality, and you'll have more people living longer. So this is the life expectancy. And we've seen that very clearly as well, as I said, in other countries. So back to, a little bit on the context and the lack of these policies leads to an environment, and this is why it's so important to introduce these policies, because otherwise you are in an environment where alcohol is everywhere. It's too cheap, it's too available, it's heavily promoted, and when this happens, it normalizes alcohol. It normalizes alcohol, including among young people. And it makes it very difficult to have conversations because even, in the health sector, it's difficult to talk about alcohol if it's everywhere and if there is no policy measures and political context that really is saying that this is a problem. And we want to have environments where one can grow in a safe mode. We want to have safer communities. And if you would remember, one of the areas that member states have highlighted that they wanted to work on was, community involvement, community participation, and health services response, together with the 3 best buys. You need all of them so that you can really create an environment where you can talk about alcohol consumption. And what happens is that when alcohol is everywhere, then you make it very difficult to talk about it. Because, again, you do not recognize it, it's very difficult to admit, and the conversations go in another sense, like, respectfully focusing on suicide only and individual risk when the context is creating the environment that is bringing the suicide rates to the level where they are. And it's not just about going out there and talk, go, reach for help. It's difficult. You come back to home. You come back to the same environment where you have all these things happening. So how do you deal with that? So how are you going to change that? So this requires a wider and, I would say, bolder involvement of the community, of everyone, of all the stakeholders to change the environment, to change what is there. Individual level changes will not change what is happening in your country. Okay? It may help a couple of people, but you will lose many more because you have not dealt with the environment. You have not dealt with what is out there. So we know that the environments lead to behaviors, and the behaviors will continue if the environments are conducive to those behaviors. If you grow up in a family that is dysfunctional, if you are subject to maltreatment when you are a child, if you see other people committing suicide, if you have alcohol around you and you drink to deal with those feelings, and you drink to be part of the society, and you drink to party, and you drink to feel better, and you whatever, you are going to change the way your brain works, and you'll have, an acute risk of, again, committing suicide. But it's not only suicide. It's that you perpetuate the situation. It continues from one generation to the other generation, and it keeps going. Okay, so you need to change the environment. You need to address the environment. And this can only be done by implementing the policies that work. So, my concluding remarks, I see, and that there's this desire to address and to change. That alcohol is everywhere. I came to Greenland, I took the plane And in the plane, you know, I took the opportunity also to look at some of the films that were available in the plane, right? And I saw some documentary about Greenland. And alcohol is there all the time. All the time. I was, you know, yeah. So population-wide interventions are needed because they are the most effective in reducing the harm for the whole population. This does not mean that individual level interventions are not needed. So health systems response, community actions are very important, but they need to be complemented with strong, bold measures that change the environment so that then you can have the room to have a different context, different conversations, and a new future where children can thrive and deal and say, okay, it ends here. So, hoping that for you, the story ends here. Thank you very much.